see a number of people are beginning to join us. Maybe we can start with the preliminaries. A warm welcome to the BID Learning Network webinar on Data for Immunization Agenda 2030, popularly known as the IA 2030 Strategic Action Plan. A very special welcome to our speaker for today from Kati Collective, and this is Kirsten Gagne. And I'm your host, Catherine Miawala, the BID Learning Network coordinator. Now, before we begin with today's business, I'd just like to remind everyone about the webinar housekeeping rules. In the chat box on your right-hand side of the screen, please type in your name and the country where you're connecting from. And if you're using one connection for more than one person, kindly include the number of the other people who are connecting on the same connection as you. We don't necessarily need to know their names, but if you could type in, we put in an example there. For instance, if in my office I'm connecting with 4 other people, I just type in my name, which is Catherine Miawala, the country where I'm coming from, which is Zambia, and then you add the number of people who are on the same connection as yourself. Then we're kindly requesting all participants to be muted and also to disable their videos, except maybe for the speakers. This is to allow the speakers to speak without any interruption, and also so that we don't affect the bandwidth of those ones who've got poor internet connectivity. Just to let you know that, of course, there will be some kind of a question and answer session for this one, because it's kind of like a focus group. So there will be a kind of question and answer session at the end of the discussion or the presentation. And in the meantime, if you've got any burning questions, you're encouraged to submit them in the chat box, and they will be logged and answered during the question and answer session. And also just to let you know that this webinar is being recorded, and that the link to the recording will be shared after the webinar. So to begin with today's topic, where we're looking at data for the Immunization Agenda 2030 Strategic Plan. We all know that immunization plays a critical role in achieving sustainable development goals, particularly as it relates to the SDG 3, which is focusing on ensuring healthy lives and promoting well-being for all at all ages. So what WHO did together with the other partners, they've been advancing the universal health coverage through the immunization agenda for the next decade, which ends in 2030. So today we'll be hearing from Kati Collective, the consultants who are engaged by the Bill and Melinda Gates Foundation, Gavi, the Vaccine Alliance, as well as the World Health Organization, to develop a multi-year framework for the Immunization Agenda 2030 Data Strategic Action Plan, which is focusing on the principle of a data-guided framework. So we will hear about this work and the work that has been undertaken by the IA 2030 Data Strategy Working Group, which includes a summary of the methodology, the processes, and the findings during the development of the strategic plan. And the good news is that you will have an opportunity as the audience to provide direct feedback and help influence the overall set of actionable priorities. So to speak to us today on this topic, we're privileged to have Kirsten Gagne from Kati Collective. She's the founder and CEO of that consulting firm, and she's a Seattle area native and is a passionate advocate for women's and girls' issues globally. Kirsten's work actually concentrates on culturally relevant technology for social impact, and with a focus on girls' and women's empowerment application for effectively educating communities and maximizing the outcomes for the underserved across the globe. Kirsten believes in digital interventions that can improve the health of mothers and babies in low and medium income settings. Kirsten, though she's a Seattle area native, she's lived and traveled extensively across Africa and in Southeast Asia. She's quite innovative, and she's been part of the team that's been looking at, innovations for social impact and social enterprise. And based on that, she has developed and led groundbreaking business models and partnerships with global multi-sector organizations, which include the governments, corporates, the United Nations agencies, and grassroots social entrepreneurs. So we've got so much to talk about this afternoon, and I don't want to take up much of the time trying to preempt the discussions here. So I'd like to give the floor to Kirsten to walk us through the presentation and the subsequent discussions. Kirsten, the floor is yours. Can I just stop sharing?
Thank you so much, Catherine. I appreciate that introduction, and grateful for all of you and your time and attention today. And hoping that today will just be kind of the opportunity for you to learn and understand what the work is that this group has been doing, and how we're looking at formatting our ultimate document and get input on that, and hoping that some of you will want to have more kind of one-on-one or smaller group consultations with us in the coming weeks and months on more detailed aspects of the content. And I also recognize that there are a few of the working group members that are on the call today, and I would encourage you, I see Chris and Karine are on the call, and also my colleague Brooke at Kati Collective. Please feel free to step in and comment as you'd like to as we move along. I'll just go ahead and share my screen. Great. So we'll go through. I will do my best to try to keep an eye on the chat if you have questions. And certainly we'll have time for a more detailed set of questions and answers as we go through. So today what I'd like to do is just give you a quick overview of the IA 2030 and specifically the mandate of this data strategy working group. We've got a very focused set of things that we're looking at. We'll talk a little bit about how we're engaging stakeholders, which are all of you in this process, and do a high-level review with you of what the action plan is looking like and get your thoughts and questions and reactions, and then talk about how you can be involved in a deeper way and really help take a look at the detailed content as we move along. So most of you are probably already familiar with the IA 2030. And if you're not, this is on the WHO's website. You can Google it and find the full document. But basically, it's a global strategy for immunization for the next 10 years, as Catherine mentioned. And we have divided our work into each of the strategic priority areas. And this is actually a follow-on to the GVAP. And it's really one of the principles is that this is all going to be data guided. And so the work that we're doing is really focusing on that data guided principle and looking at what needs to happen to ensure that this work can be data guided over the next 10 years, and developing an action plan for the various levels, global, regional, national, and subnational levels, for what needs to happen to ensure that data can be collected, analyzed, used to really guide this work over time. So this is the theory of change for the data guided core principle. And this is just to reflect that what we are doing is really helping to achieve passage through this theory of change. So we're really looking at, what are these building blocks? What needs to happen to make sure that data is available and fit for purpose and can be used for planning, implementation, and monitoring so that coverage and equity and efficiency can increase and morbidity and mortality can decrease. So what we've been looking at is what are the bottlenecks and what are the actions that need to happen to make this actually work. So our objective as a group is to develop a multi-year framework for strategic action. And we're focused on using data to achieve the goals of the IA 2030 in alignment with this data-guided annex. And it will serve as a work plan of sorts for the global immunization data ecosystem to enable the delivery of the IA 2030 strategy and align the associated data-focused funding, streamline annual planning cycles, discussions, and strategic investments. You know, our understanding is a lot of these now are somewhat disconnected and disparate, and the idea is that this would help streamline that and align the ecosystem around a work plan, and then prioritize the timing with support to countries in adopting and implementing recommendations. So really one of the ideas is that this really is tied to the major processes and funding of the organizations like Gavi and WHO and Gates and others as they look at aligning around this action plan. Our output is an analysis of key data-related problems and clear recommendations for addressing them. I'll talk through with you how the methodology we've used to get there, and then tying that to a work plan with timelines and priorities for what needs to happen when over the next 10-year period, and having goals and targets so that we can measure the progress over time. So I won't read all of these guiding principles, but you can just take a look here at these. Catherine also has this presentation, and if you'd like this presentation so that you can look at it in more depth, I'm sure she can send that to you. But the guiding principles are really that this be people-centered and focus on the people who will be implementing the work. And so that's been a major part of the lens as we've gone through, and the reason why we're engaging in a multi-step stakeholder process as we move through this work. We want it to be specific and actionable. There's been a lot of really great work done with the SAGE and the IDEA work and others, and we really did start with that, and we continue to cross-reference that. But the idea is that we take this to a further level of actionable detail. We want this to be relevant at all levels: subnational, national, regional, global. We're looking at being holistic and looking beyond just the immunization data silo, considering universal health care and the other aspects of the health system. We've also been thinking a lot about trends that are not necessarily exactly immunization trends, but what are some of the things that we need to think about for how this work will evolve in the future. We know that we're in the middle of, you know, a real game changer right now, but what is that going to mean over time, just in terms of things like climate change and people moving around and new technologies that might be available and things like that. So we've really been trying to be forward thinking and are hoping and assuming that this work will continue to iterate over time as those kind of external factors change. So the actors who have engaged in this core work, there's been a planning group with representatives from Gavi, the WHO, and Gates, and they've really just served as our touch point to make sure that we're moving forward in ways that make sense for their work and the way that they envision this. But we've been engaging a full group of over 20 people that are representatives from not only those organizations, but also Village Reach, JSI, PATH, the CDC, CHI, ACASIS, UNICEF, and others. And these folks have been involved in pretty detailed meetings that we've had in full groups. And then we've broken up into subgroups that are focused on each of the strategic priority areas. So they've put a lot of hard work into this. And then we've also been doing one-on-one, what we call flash consults with folks in this group, as well as others, to really do a deep dive on the content. And the stakeholders that we're looking to advise us, and who we also hope will find this work useful, including all of you, is this list here of a whole array of partners at different levels within immunization programs, Ministry of Health, donors and funders, technical partners, regional technical partners, non-health decision makers, and broader primary healthcare stakeholders. So our key milestones in the stakeholder engagement plan, we've been doing outreach and material preparation over the last couple of months. We began in July collecting some initial stakeholder input, really doing more of the stakeholder input through sessions like this. We're also working with the eScholar Network and others to do these kind of broader webinars with more people on them. And then what we're looking at is we're integrating what we're hearing from this, and then we'll be looking to do deeper dives in September and October with some of you who've been involved in these first rounds to really help us go through the final content in more detail. So this is the framework we've been using for getting to this detail. We first took a look at each of the strategic priority areas. Then within those strategic priority areas in the IA 2030, and again, you can reference that document directly, there's a set of strategic objectives. There are 2 to 4 or so strategic objectives for each of the strategic priority areas. And what we did is we took a look at each of those strategic objectives and talked through use cases. And the way that we framed use cases was looking at the national, or looking at the global, the national, and then what we're calling operational or subnational level, saying with data, thinking about data, how would someone at the global level, what would they need to be able to use data to achieve that strategic objective? So we used kind of if-then use case format. So if somebody at the Ministry of Health had a certain set of data, then they would be able to make this decision or take this action. So we did that in a very detailed manner across each of these strategic objectives. Then we asked, okay, what prevents that person or that actor from being able to have that information to take that action? And looked at what the bottlenecks or challenges were. Then we started looking at, for each of these levels with the use cases, the challenges, what would the solutions be? And then we looked at how would we execute these solutions? So what are the actions that need to be taken? And now we're taking a look at who needs to be involved in taking those actions. So who at the global level, who at the national level, who at the subnational level needs to execute on this action. And then we're starting to look at, now taking a look at all of these actions that need to happen to address the challenges, how do we prioritize these? And prioritize them in terms of what needs to happen first, and the ones that if they're resolved, they would actually impact several other areas. But then also looking at them over time, because again, this is a 10-year plan. So what are the things that need to happen immediately in the first 1 to 2 years? What are things that are more 3 to 5 year actions? And what are things that are maybe nicer to have a little bit later down the line? And then finally, how will we be able to measure how this action plan is achieving its results? So that's the work we've been doing. We, again, we've done a pretty thorough look at the bottlenecks and challenges. We're looking at the solutions. And now we're really starting to delve into what are the actions and who needs to be involved. So some of the things that we'll be looking to all of you for later and in a more one-on-one format is to actually look at some of these strategic objective areas from your particular lens and let us know, have we really captured the use cases? Have we captured the challenges? Have we captured the actions? Have we captured who needs to be involved? And are we prioritizing them correctly? So you can see it's very detailed work, but we are working to make it in a digestible format. So what we found, interestingly, was as we looked at the challenges, we came up with kind of a universal set of challenges. And so in some ways that helps us look at what actions need to be taken at the different levels to impact these universal sets of challenges. And this is more just kind of for your information, because I think it's interesting that these kind of came out in these buckets. knowing though that at each of the levels and for each of the use cases, there's nuances to these challenges that need to be addressed. And so we're trying to both group these at this higher level, but also understand that there's nuance that needs to be addressed. But it's things like lack of an enabling governance structure, data use culture is not pervasive in many places. Data needs to be complemented by improved skills and capacity. These are things that are really very much about what we kind of think of as the enabling environment for data. And then there are a bucket of what we call direct determinants. So these were things that actually directly impact the data itself, that it's not actionable, the availability and usefulness of data. It often does not provide the full picture. There was a lot that came out around sharing, access, and triangulation of data. Stakeholders collecting and using data, and this again was at all levels, lack coordination, and data on resources and financing is limited or incomplete. So these are a lot of the things that we're looking at across these strategic objectives and across the different levels of saying, how do we address these? So finally, what I'll show you before we get into the questions is the way that we're thinking about formatting this. And what I'd like you to think about as you look at this is, does this feel like a way to put this information together that feels useful to you, that feels useful to the level that you're at, the decisions that need to be made? These are not fully populated yet, but this is more kind of illustrative. So this one, for example, is strategic priority 2, which is commitment and demand. And then here you can see that the priority wording is that immunization is valued and actively sought by all people, and health authorities commit to ensuring that immunization is available as a key contributor to enjoyment of the highest attainable standard of health as a fundamental right. So this is strategic priority area 2. And the specific objective that these actions are focused on is to ensure that all people and communities value, actively support, and seek out immunization services. So this is an example of the global, and I'll show you in just a moment what the national and operational levels look like for this. So the use case in this instance is if global level partners had disaggregated data, below the national level data on health worker availability relative to population, including understanding of mobility and migration issues, clear workforce competency tools and standards and training at the global coordination level, they could prioritize resource and advocacy efforts. So an action, so again, we haven't fully prioritized these yet, but it would indicate what the priority is for this use case. And then the actions would be to support methods that countries can use, how to develop tailored vaccine messages based on local barriers to vaccine uptake. Then we would note who needs to do this at the global level, and then what resources are needed and what else should it link to. And this what else should it link to, we're finding that there are other resources out there that relate to some of these and or other strategic priority areas that need to be linked to. So again, this is an example of the kind of content that's coming out. I'll show you, this is for the national level. So again, this is a use case that's for the national level, that if program managers had data on demand for vaccination among communities, including on some of the underlying reasons for lack of it, they would be able to better prioritize resources towards creating demand, fine-tuning service delivery, communication and advocacy strategies to better reach those populations. So an action that can be taken at the national level is to strengthen systems for receiving feedback from and informing the community on immunization and aim for effective and efficient bi-directional communication. So again, I encourage you to kind of take a little bit deeper look at this, and we can certainly circulate this information. And then finally, at the operational level, this use case related to this one is if operational level managers had data on demand for vaccination levels in the communities they serve, along with better ways to evaluate the underlying causes for lack of demand, which also includes availability. They would be able to fine-tune service delivery, communication, and advocacy strategies to better reach those populations. So this one, the note here is that this needs to link to SP6, and SP5, which are on supply and outbreaks and emergency. So we would note that as well in this resource column. So an action that can be taken at the operational level is to deploy manual due and defaulter tracking lists, deploy locally relevant messaging options that reinforce the value of completing all vaccinations. So that was a lot of information. I will just check the chat here and see if there's any questions at the moment. I don't see any, but let's just open this up. And what I'd love is, these are we don't have to go through each of these questions one by one, but these are the kinds of things we'd really love your input on at this kind of higher level stage. Does this resonate, and does it feel like the output will be at a level that feels useful for you? Why or why not? What other things should we be thinking about in terms of content and format? What else would make this framework something that you and your leadership would apply and implement? So who needs to buy off on this? Who needs, what processes does this need to be a mandated part of? And who should we be sure is involved in providing input? And please do note my email address here, and feel free to either put in the chat or send me an email if you're interested in having more deep dive consultations on pieces of the content that I just shared, or if you have peers or coworkers that you think we should be talking to. So I will stop there and really encourage you to go ahead and ask a question. I think with the number of people we have, let me just check here. Yeah, we've got 16 folks. If you could use the raise hand function, I think that'll help us go through questions in a slightly more orderly way. So go ahead and raise your hand if you've got a comment or reflection or question. So anyone? I'm not sure if, are people able to unmute themselves? If you've got any trouble with unmuting, feel free to put something in the chat. I also encourage any of you who are on, okay, so here's a question here from Maseret. How are we going to ensure the involvement and monitoring of media in the demand communication side? Let's see, I just want to make sure I understand your question. So Maseret, maybe you can unmute. I just want to clarify. Yeah, go ahead, Maseret. I see your hand up.
Thank you for your presentation. Unless I missed, you have seen that lately, if a single outbreak is picked by media and then it goes. Partly we can use it for generating the demand for services. But I didn't see it in the framework of the monitoring. How are we going to capture those? It's just probably service oriented only. So I'm trying to respond to the bullet questions. Yeah. Who should we be sure also that we involve? Because the contribution is powerful, but it can also limit the participation of communities. That's where I'm coming from. Over.
I understand. So thank you very much. I think that's a really great point. And we'll note that down. I think certainly in the SPs around demand generation, that there probably is something that we need to think about here about proactively and reactively being able to respond to media on these issues. That's so important right now. So great point. And Maseret, if it's okay with you, we may kind of come back to you and ask you for a little bit deeper dive thinking on that as well.
Of course, duly noted.
Great, thank you. And if there's anybody that you know of who's working on this specific issue, part of what we're doing is identifying people that have kind of deeper expertise in some of these very specific kind of strategic objective areas and having rapid consultations with them. So thank you. Okay, other questions? Also encourage Chris and Karine, Brooke, who've been involved in this work. If there's anything that you want to say or other questions that you want to ask of this group, please feel free. So Catherine asks, are we looking only at public sector or will you involve the private sector as well? We are looking at the private sector as well. We're looking at the private sector in a variety of different pieces of this, including in the innovation related SP, but also around delivery and all of that. But I think also, again, duly noted, Catherine, we need to make sure that we're, that lens is across kind of the entire piece of it. Again, it has come out in a few pieces, but I think there's probably a look that we can do to make sure that we've captured all the places where private sector needs to be involved.
And Catherine, this is Brooke. I'm curious if there's a specific element of the private sector you have in mind in your question. We've been looking at it in terms of the private sector within sort of tech and those private sector actors that are actually collecting data, but then also looking at it in terms of the private sector within private health facilities. So I'm curious if there's another element that we might be missing.
No, I think you've actually answered my question, because I was looking at, are we looking at the corporate world? I think that has been answered in the area of technology, and then we've also been looking at private sector in terms of service delivery. I think you've ably answered the question.
I think what's a little difficult with private sector with these kinds of action plans, I think they, if we have actions that, and we haven't gone thoroughly through the who needs to do some of these things, but if there are actions that require the private sector, I think it can help guide conversations with the private sector. But, I think there's not a huge amount of leverage that this plan has to make them be accountable to actions that are in this. But certainly I think it can be a vehicle for guiding and directing and prioritizing what some of the private sector action should be.
Thank you, Kirsten, because I think there's been some concern raised in the past about, how, because I think the whole, when you look at the, the immunization agenda and how you look at the SDGs, they're talking about, it should be multi-sectoral, make sure you bring the private sector on board and all that. So I think that's where I'm coming from. I was just thinking along, those lines. Thank you.
Yeah. Great point. Thank you.
Kirsten, I wonder if it would be helpful just to go back to the visual depiction of one of the SPs and just give everyone a minute just to digest it a little bit, because we are really interested in, does this format feel intuitive? Does it feel usable? If we built out all of this information for all 7 strategic priority areas and there were actions for each, could you take that document and really use it in your work or distribute it to your colleagues and feel like it was actionable? So feel free to chime in with reactions or note in the chat, you know, this part feels confusing, or it would be great to see, you know, this element highlighted. Any reactions are helpful.
I see that Danes is asking, will you involve sub-national, regional, province immunization officers? So maybe if you can clarify, Danes, do you mean in the plan itself or in reviewing of the plan? Because I think in the plan itself, we definitely have sub-national and actions that can be taken at the sub-national level, which I'm sure some of those will be regional and provincial immunization officers. But in terms of review of it, it would be optimal, but we are finding that these folks are particularly busy always, but particularly in the moment of COVID. And we're trying to be mindful of the need to get as much country and particularly subnational and national input as possible, with the fact that it's particularly difficult to do at this moment. But if you know any folks that might want to do a deeper dive with us on some pieces of the content at that subnational level, we would love to connect with them.
There's a hand there. I think that's Meseret.
Let's see here. I think, yeah, I wasn't able to put her, since I'm not the host. Meseret, did you have another question or?
No, it was the previous one. I'll take it down.
The previous, okay, yeah. Thanks. Great. So what I'm hoping is, Catherine, maybe it's possible, can we send an email to the group who signed up for this and participated in this, where we can send this PowerPoint deck for them to be able to review a little bit more, and then make sure that my email is CC'd on that. And so anybody who's interested in having a more detailed kind of, we're trying to keep these conversations at a half hour when we do the detailed conversations, just to be respectful of your time. But I know it's hard in a large group format to give meaningful input, but we'd love to have a deeper dive conversation with any of you who are willing, you know, over the next several weeks. So if we could send that email out, Catherine, I think that could be useful for people to be able to look at this. Okay.
No problem. Yeah, we'll be able to send out the email and the slide deck together, so that they're able to digest the information more. And and feel free to add any other documentation or links to other documentation. If you can share those with us, then we can share them. We can share them out as well.
Sure, I think we can definitely share a link to the website where the full IA 2030 document is, and we'll send this out. And then what we'll want to know from people, and we can do this via email, is just find out which strategic priority or strategic objective area they feel most versed on, and that would be the area that we would really focus on with them.
Excellent. Yeah, I think that's a very good idea.
Great. So maybe we should give one last offer for questions or comments. I see that there's a new message. Just a minute. Okay, great. Subhash says that would be really helpful. Okay, great. Okay, we'll do that. And also share the recording.
Oh, yes. Yes, we will be able to share the recording.
Great. So Catherine, you've got my PowerPoint and the recording, and I'll quickly grab the IA 2030 link and send that off to you, and then you should be able to get that email out relatively quickly to everybody.
Oh, wonderful. Yeah, I'll be able. Yeah, we'll definitely be able to. We'll definitely be able to do that.
And I see from Danes, he says data use is challenging and will be interested to learn and helpful. Yeah, it is challenging, and I think that's part of what we need, is to make sure that we're developing the right set of actions to address the right set of challenges. so that we can really kind of take data use to the next level over the next 10 years. Sorry, go ahead, Catherine.
Okay. Are there, I don't know, are there any other questions in the chat box? There's nothing?
I don't see any popping up.
Oh, okay. So before we wrap up, Kirsten, would you have any last words from you and Brooke? What would you encourage everybody to do, and why this exercise is very important, so that they're really motivated?
Yeah, thanks, Catherine. I think, it is important because as this is, will be a prioritized action plan that funders will be using to prioritize how they look at their funding. We really have an opportunity to help us shape and make sure that the things that are put in here are ones that are actually useful and ones that are meaningful to address the kinds of challenges that you know and encounter regularly in your work. And we can't be really thorough unless we have your input. So really invite you to respond and let us know who else we need to be talking with. Brooke, did you have any final comments?
No, I think that covers it. I mean, I think we just want to ensure that this is not divorced from reality. And so we definitely need the input of folks who know to make sure that is that it's actionable. So thank you for your time, and we really appreciate it if you can spend some time to review and provide input, and we will take your input in whatever way makes it easiest for you.
And thank you for hosting us, Catherine.
Oh, you're most welcome. So I'd like to thank everybody for joining us during this session. I think this has been amazing, very, very interesting. There are all these documents that we hardly, get to read, and we kind of don't have the time because we don't understand. We're really grateful for the for Kati Collective to come in and share this document with us, so that we're kept abreast on what's going on in terms of its development. And we're also grateful to the participants who joined this discussion. I think it was quite engaging, and I could tell there's a lot of information there, and I think once they get to read go through the PowerPoint presentation as well as the link that will be shared, they'll probably have more questions, and we're certain that Kirsten and Brooke will be there to respond to any questions that come through. And we hope that most of you will also be able to take part in the one-on-one sessions that the consultants would like to have. And also, I think let's think broadly about which other stakeholders they should be able to talk to. If you know of any colleagues that you have or any organizations that have been left out, I think it would be good. They're trying to be as inclusive as possible. So I would like to thank everybody for joining us this afternoon. We will be sharing the recording together with the PowerPoint slides that Kristen shared this afternoon, as well as the other links for the documents. And we're really grateful that you're able to connect with the BLN. Please feel free to link up with us and connect more with us on the various social media platforms, the Facebook, Twitter, the Google groups. We normally produce a lot of blogs. Please take time to have a look at that. Have a look at our website as well, and also sign up for our newsletter if you haven't signed up yet. So having said that, thank you so much, everybody. Please, let's try to keep as safe as possible from the COVID-19. Let's not forget to mask up and ensure that we wash our hands and or sanitize them frequently, and also observe the social distancing. Thank you very much. Until next time, bye-bye. Thanks, Kirsten, and thanks, Brooke.
Thank you. Bye-bye.
Thanks. Bye.
Bye.